Good evening. Welcome to Food to Fuel Nutrition for Active Women, hosted by the HSS Women's Sports Medicine Center and the HSS Education Institute. Thank you for joining us. We have an exciting discussion tonight on this topic. We'll be starting with how nutritional needs vary across the lifespan and the components of a healthy lifestyle. And we'll also be covering some common misconceptions about nutrition and how nutrition affects bone health and muscle mass, and discuss as well nutrition for injury prevention and management. My name's Polly de Mille. I'm a registered nurse and clinical exercise physiologist. And we are so fortunate today to have our two guests, Heidi Skolnik, who is a sports nutritionist, a best-selling author, and an expert in women's and performance nutrition, and Dr. Jaclyn McKenna, who's a sports medicine physician who specializes in non-surgical treatment of acute overuse and chronic musculoskeletal injuries. So we couldn't have better people to tackle this topic. We're so glad to have you here, and let's get started. So before we dive into specifically nutrition, I'm going to address Dr. McKenna some general questions about when you're seeing your patients and you're thinking about sort of evaluating them for just a healthy lifestyle. Where does nutrition fit into that picture?
Sure. Thanks, Polly, and thanks everyone for joining. So my background is in internal medicine, and I did additional training in sports medicine. So as a physician, you're seeing how nutrition is one of the things that is playing into overall health. So I kind of think of it as like physical health, mental health. You could probably tack on a bunch of other ones too. And then within physical health, it's sort of are you seeing your doctor, doing all the preventative things and having your medical conditions treating appropriately, and then the rest is kind of like lifestyle and all the other preventative stuff. That's the stuff that's in your own control, and you're kind of on your own to make sure that you're doing yourself justice to educate yourself. So that's why you're all here today. But even just within lifestyle, it's nutrition, sleep, and exercise are kind of those big buckets. So it's just important to remember that we're going to talk a lot about nutrition today, and we're going to give you a lot of pearls, but it's just like one piece of that whole puzzle. And if you think about it as like different buckets, sometimes each bucket has to have something in it, and it can't, not letting one go completely empty is sometimes is the goal, and good enough is sometimes good enough. So we want to just make sure that we're talking about like big themes and not letting perfect like get in the way of good enough.
Yeah. And do you find that your patients like have an easier time maybe prioritizing one of those components versus another, that they're able to kind of focus on one and then let the other slide?
Oh, absolutely. We see that all the time. And I think sometimes it's easy to focus on the thing that's going well or that you know a lot about, and something that you're good at. So you see that a lot when maybe someone has their nutrition dialed in, but the sleep or something is totally out of whack.
Yeah, so this just one piece of the puzzle is the nutrition. And if you're seeing your patients, are there certain signs and symptoms that when you see them you think it could potentially be related to poor nutrition?
Mm-hmm, sure. So when poor nutrition turns into like a medical problem, that's definitely the more extreme like end phase of that sometimes. But overweight or obesity is definitely something we come across a lot as physicians, and how that relates musculoskeletally, like most commonly is arthritis, like with being overweight or obese being the biggest risk factor for that, as well as some other overuse problems. Less common, but also definitely like something we're going to talk about is being on the undernourished side. So not getting enough like total calorie intake. So you can see that in people with different medical conditions, maybe people who have had gastric bypass surgery or malabsorption problems, so or eating disorders. So there's a lot of different medical conditions that can lead to being undernourished and putting someone at risk for things like stress fractures. And then that's kind of like too much or too little. And then within the micronutrients, in our like, I don't want to say standard American diet, but like we're like readily accessible to, and you don't see specific vitamin deficiencies as much, but the ones that are more common would be iron deficiency, anemia, and occasionally B12 deficiency. Really only going to see that in like a vegetarian population, but that can you can see that clinically as well, with different, like, either anemia or neuropathy.
Would women with like heavy periods be more likely to be needing to be mindful about their iron intake?
Absolutely.
Yeah, I would think that would be, something that, if you're not a big red meat eater, you'd probably need to focus a little bit more on that. And then, and this is really for both of you, just across the lifespan, are there different nutritional needs or things that you'd be thinking more about when you're in childhood and adolescence versus childbearing years versus, postmenopausal and aging? Are there certain times in your life where different nutritional strategies would be more important?
Well, I think that especially from the perspective of sports nutrition and what we see is those years up until 18, most people don't realize, our bones don't just grow in length, they're growing in density. And our bone is not like a hollow hose or a solid pipe. It's really this matrix. And so it's the architecture that matters. It's the density that matters, the geometry. There's all these different aspects. And 90% of our bone is actually built by age 19, and then a little bit more in our 20s. So we talk about reaching our peak bone mass by the time you're in your 20s. And then that's what you use for the rest of your life. And so those teenage years, from really like right around pubescence, is really, and those years after is just so important for getting your peak bone mass. Because if you don't, we think of osteoporosis as maybe this geriatric disease, but often it is actually a pediatric condition that manifests later in life. And so it's so popular to avoid dairy these days and to have all these dairy alternatives. And you can get calcium from other sources, but you would need 3,000 calories worth of almonds to reach your calcium needs, or 12 cups of broccoli. So possible, not probable. And in our country, most of the calcium is from dairy. You can get it from sardines. Other countries eat bones, fish, small fish with bones, and might get it that way. So calcium and vitamin D. It's a lot of anchovies. They're good. They're on the list. They're Mediterranean. But it's just not a lot of teenagers are coming home and having anchovies with some cookies after school. So really making sure that calcium and vitamin D are adequate, and some exercise and movement stimulus for the bones is so important in our teenage years. And then we could get into diet culture and the negative, but I think we'll cover that a little bit later, but adequate calories. And then I think, the years after, and, jump in if I'm missing something, in our 20s and 30s, when life gets full and we're starting work and we're pulled in different directions, and whether it's an active social life and maybe a little bit more drinking and diet culture, under eating during the day, or once there's children involved and you're taking care of children and you're eating their food and not prioritizing yours, and sort of picking and not necessarily getting in just regular meals, sort of that foundation. It's the foundation of adequacy and balance. And I think that kind of just sometimes goes out the window. Then we have perimenopause and menopause, when our bodies do begin to change and we begin to lose muscle between ages really 30 and 40, a little bit less than 1% per year. And so now making sure that we're getting adequate protein distributed evenly throughout the day. Breakfast is the area that most people just don't get enough, whether they're skipping breakfast or they're grabbing even something that they think is nutritious, like oatmeal, which it is, but there's not a lot of protein in it. And making sure that they're doing strength training, that combination, which builds that muscle bank as we age, so we avoid sarcopenia. And then that brings, as we get older, B12 is something that we might not absorb as well, need more of, different challenges. And then, of course, throughout the lifespan, depending on food security and issues of food insecurity. And I think the reality is that there a blanket over all of this around diet culture. And, at the Women's Sports Medicine Center, we focus so much on function and performance and health. Mm-hmm. And then where your body is, once you're eating adequately and balanced and consistently, and you're exercising and engaging in physical activity, that's where your body weight will be.
Right.
And it's okay because you're focused on what you can do, not just on what you look like.
Right. And so for a kid, if your focus is really making sure you're getting adequate calcium and vitamin D to support the bone growth, and then as you get older and you're taking care of your parents and your kids and everyone else at work and you're not thinking about your own diet, it's really thinking about making sure you're taking care of yourself and in all of the nutritional needs, and then moving more into focusing a little more on higher protein intake as you start to get into those years where it's going to be a little tougher to maintain
your muscle.
The muscles you've worked so hard to get in your youth, and then maybe a little more vitamin D when we're really getting older.
So when we're older, what happens is actually when you're younger, it's kind of easy to build muscle. We're in a growth stage, right? So you drink that glass of milk, for example, 8 grams of protein, and you're like, muscle, right? You don't do too much. But when you're older, your body goes, 8 grams of protein, I'm not doing much with that. We have what's called anabolic resistance. We're resistant to actually putting on muscle. And we have to press that muscle building button by having a little bit more.
Okay.
And that's about 25 to 30 grams of protein, depending on your body, so even a little bit more depending. And if you are active and you are lifting weights, which is the duo that you really need, your body's more sensitized and will use the protein better. So there's a benefit aside from actually what you're doing in terms of the diet movement connection. And so we do need that as we get older.
Okay. And you mentioned vitamin B12. At what age would you start to maybe thinking about that, or when you?
It's hard to say. Everybody's system is different, and gut health, which we know is so important. So how we absorb foods, but probably, after age 50, which, used to 60. So I can't, there's not a cutoff for that. There's no number. But I think, I know we'll talk a little bit more about supplements, but, that's where I think like a 1-a-day vitamin. It's not like you have to be taking lots of different vitamins and all, but there's enough in there to help supplement in case you're not absorbing. We don't have, we lack intrinsic factor.
Right.
And maybe it's 60 or 70 because it's different for everybody. But, it's a good idea to just, and then as you had mentioned, if you're vegan, that's at any age that you would need B12, because B12 is found in animal products, not in plant-based foods. And so if you're vegan, you need to be getting in B12, supplementing your diet with it.
See, I probably knew that at one point in my life, but I totally forgot that. So thank you for bringing that up. Now let's just moving on a little more specifically about nutrition. And I think, it's really, there's an overwhelming amount of information, whether it's through social media or anywhere you read about everything. This is the best diet, or that's the best diet, or, this is how you should space your meals out, or some of these things. So just if you could touch on sort of fad diets and some of these, the recommendations that people are seeing. And how do they navigate those? And how do you find, choose maybe what actually is a reasonable approach to eating and getting the results you want?
Yeah, I know fad diets, I've been doing this a long time, and they do cycle. And every year it's a new hot thing that's in. But most of the fad diets versus well-researched dietary patterns, and I'll distinguish the two, but the fad diets are usually very restrictive, right? And they really are so focused on weight loss, making incredible promises that, we know that the more quickly you lose weight, there's damage to our bones, there's more likely that we're losing really more muscle than fat, and we have more weight regain, and they're not practical to your life. Like, I just think of something like the Whole30, which is not as popular now as a few years ago, but it was very punishing, right? First of all, you had to restrict foods like beans, which are one of the most nutritious, which is really a superfood, right? One of the most nutritious foods. So you cut out dairy, which we know we just went through, we need for for bone health. And so, and then if you messed up, you had to start over. I mean, that's just so punishing. And food is pleasure. Food should be pleasurable. It should be hopefully nutritious, but sometimes it's celebratory, and sometimes it's functional, and sometimes it has to do with sport and performance, and so it serves so many different purposes in our life, and our dietary patterns should allow for all of that. And if it's restrictive and it's telling you you can only eat certain foods every other Tuesday at 4:00, like that's just not that's just not sustainable. So a dietary pattern like the DASH diet, dietary advances to stop hypertension, or the Mediterranean diet, which is so well researched and has been shown to be advantageous to our health and well-being, is one I could get behind. But the other ones are, you're wasting your time and you're wasting your money, and like intermittent fasting.
Right. So that's another. That's pretty hot. Intermittent fasting. So timing of your meals seems to be something that I think is a more recent phenomenon of people focusing on, of how long it is or what time of day they eat. What are your thoughts on that?
Well, there's first of all, why are you doing intermittent fasting? Because there's a lot of reasons, and there's a lot of different styles. Some are like days, some are these, a window, which is the most common. Like you might eat between 12 and 6, or a 5-hour window in the day. But, interestingly, and I think people in the science world tend to do this more than people in the public who, as you mentioned, it's just very hard to sort through what's out there. So a secondary outcome, most people don't look at the secondary outcomes of the study. There was a study in intermittent fasting, and both groups had the same amount of calories. So the time-restricted eaters versus a control group. They both had the same number of calories, which is what counts, which is one of the things that counts. If we're talking about weight loss, for the purpose of weight loss, both groups lost the same amount of weight. But the time restricted lost, as I mentioned, when you lose weight, you lose fat and you lose muscle. You lose about 30% muscle when you lose weight. For the time restricted eaters, they lost 60% from muscle.
Wow.
So it wasn't just a matter of what weight, it was how much muscle. And I just finished saying how important it is and how hard it is for us to maintain our muscle as we age. And our muscle is what is our metabolic machine. Our muscle is what allows us, and I'm not talking you have to be a bodybuilder muscle. I'm talking, muscle is the cornerstone to our health and well-being, to our mobility, right, to clearing out glucose in terms of preventing diabetes and normalizing our blood sugar, hypertension, cognitive health, our gut health. Like there's so many different, like muscle is a cornerstone. And so intermittent fasting doesn't help us maintain, as we age, our muscle.
Wow. I had no idea.
So fascinating. I didn't know that either. And it's so interesting, too, to kind of bring in, like, the muscle part as, like, that's what's important for women. Like when you look at people in their last decade of life and you look at, like, what a good quality of life means, for women, it's that sarcopenia or muscle loss that can just be devastating in terms of quality of life. And, and thankfully, like, the research and everything is coming around and including more women, but like up till now, the focus has been so much as like nutrition, cardiovascular outcomes, like, and then like, which is, like the Mediterranean diet, great, wonderful for that. Right. But, and it's like an overall healthy diet and a lot of the themes correlate, but like maybe we should be focusing, like we should be targeting women differently than men.
Well, but even
important.
like the Mediterranean diet, which again has so much research, doesn't talk about timing, doesn't talk about protein needs and how protein needs change as we age. And to your point, that fragility and that sarcopenia that we think of as being an old age thing actually doesn't just happen at old age. It's been starting gradually and slowly. It accelerates after a certain point. But if we can start, what we do now predicts our well-being 10, 20, even 30 years from now. And so, around that menopausal time is a great time if you haven't already. And I think more and more women are embracing strength training. Certainly when we came up, for sure it was, if you had sneakers, you can go. And even now, for many people, if you go to the doctor, they'll say, are you exercising? And they go, yeah, I walk 3 times a week, or I bike, or I run. And they go, oh, that's great. They don't say, are you doing strength training? Or are you doing balance exercises? Which as we get older, those when you're younger, you could have pretty good balance without having, we lose our proprioception. So, I think that you're right. It's that combination of strength. It works, our movement and our nutrition really do well together.
So it's really not so much the timing as the quality of what you're getting in the course of a day, rather than when you're eating it.
There's not a magic. There's not.
A magic time.
I think and again, if you're looking at bone health, if you're looking at your cognition and your mood and hormonal regulation and all of these other things, not just weight.
Yeah.
Eating consistently throughout the day. Now, some people don't have an appetite in the morning. They don't, many times I think people who don't have an appetite in the morning often do tend to overeat at night. It catches up with them. And then because they overeat at night, they're not hungry in the morning. And sometimes when we flip that, they actually do better and they feel better and they have more energy in the afternoon. And so, but look, there's variability, and you don't have to fix something that's not broken if it works for you. Everyone has a different appetite and different body. But as a blanket statement, when I think of that timing, I think of consistency throughout the day timing as opposed to limiting a small window.
And then, as you said, we've been doing this a long time. There was Atkins, but there's always, I feel like, always been the low carb or no carb diet out there. That is one of the go-to diets. What are your thoughts on that?
Interestingly, there's just some new research. So I can't talk definitively because it's been a few papers that have really noticed that it's not just, and we haven't really talked about low energy availability, maybe we'll talk about that next, but it's not just low energy availability, but it's actually low carb for women don't respond as well. So men might do okay with a lower carb, although I know many who don't. They don't think as well. They get that brain fog. But for women, that low carb does affect them hormonally, affects their mood, concentration, and bone health. And so it just may, just as in the general health and medical field, a lot of the research has been done on men, and then we apply it to women. And we're not the same. Or maybe we are. We don't know because we don't have the research, right? And so probably there is a difference. So it's not just your total calories. It is eliminating carbohydrate. That doesn't mean that you have to carbo load, depending, the whole idea in terms of performance is you need adequate. So you have a core diet and then you add if you're more active, but you're not taking away. And so it's not like when I say, people are so carb phobic, but it's having enough. We're not saying go out and eat bags of, potato chips or it's not like you can have 3 cups of pasta versus you have a cup of pasta and you just put some protein, you put some veggies in, and now it looks like 3 cups. So it's just an amount based on your activity and your needs, but it's not an all or none. And I think we have this all or none mentality often, and it kind of seems easier because it's hard to navigate. Doesn't have to be that hard to navigate.
Now, an even bigger can of worms to open is the topic of supplements, dietary supplements, which, there's whole stores that are just those. And I'm sure you get asked, I could see where, in your case, if you have somebody with anemia and you're recommending an iron supplement or something, you're actually basing this on lab work. But I think a lot of people don't do that. They don't think about, do I really need this? They're looking at all these recommendations and all the things on the shelves and just thinking, maybe I should be taking these. So, just sort of generally, are there ones that you would typically say not a bad idea, and perhaps even very helpful?
I'll speak first and then Heidi can. So I agree with the multivitamin. I think we're creatures of habit, and sometimes we can just, which is not a bad thing. We could eat the same thing for breakfast every day and have the same 3 lunches and the same 3 dinners. So you never know if maybe there's one micronutrient in there that maybe it's worth just taking a multivitamin. I don't think it has to be anything fancy or expensive. And it doesn't even have to be every day. It could be every other day, just a little something. And then I think vitamin D is probably worth taking. It's nice if you have a lab value that you could base it on, because a lot of people will supplement with vitamin D and it'll still be low. And they actually need quite high prescription dosing to get into a healthy range. But I think most of us are probably low. And there's still research to be done in terms of vitamin D and long-term outcomes, but it's probably worth during the winter months for most of us to take 1,000 to 2,000 units a day.
Yeah, and I would agree. And I think obviously it's always better if you get a lab value for again, age-wise, for adolescents when you're growing, if you're athletic, if you're vegan, vegetarian, dieting, have a heavy period, iron is a nutrient of concern. And we like to suggest that you actually get tested every year or even twice a year if you're really active to test your iron levels. But you wouldn't go ahead and supplement without knowing that because you don't want more iron. Vitamin D for sure. And then I think understanding like, again, that multivitamin, it's not curing cancer, it's not preventing heart disease, right? And it's not a prescription. So it's okay if you don't take it every day, but it's just there to cover bases. Then other ones like omega-3 fatty acids. Do you eat fish? Don't you eat fish? A lot of people recommend that and take that. It's expensive. So you always have to balance what you're doing. None of these supplements are going to make up for a bad diet. But can they be helpful or indicated? We just talked about vitamin B12 when you're older, and that can be found in that one a day. So you don't have to take separate horse pills. Calcium, food first, because food is giving us so much more than a single nutrient supplement can give us. But if you're really not reaching your calcium needs, then having a supplement to supplement your diet makes sense.
So would you say generally, like before you take iron or vitamin D or something, it would be worth asking your primary care doctor or whatever to get actual lab values to see what's going on?
To be most effective for those, yes. Like, again, it won't hurt you to be taking 600 to 1,000 IUs of vitamin D, but to your point, you may actually need more than that. So you're not going to get the benefit because it's still not high enough. But most people are going to need to supplement because they're just not going to get enough of that from the sun.
Yeah,
Great.
I mean,
we could do a whole other thing. I know there's so many more that people have questions on. But
I'll just add that, when you see it could be with your other routine lab work, but vitamin D level and then an iron panel with ferritin being like the key number, because you could be iron deficient and your red blood cell, you won't be anemic at all.
Okay, so it's like your
the
iron
ferritin.
stores would be. Okay.
Yeah.
Okay, so now let's moving on to.
Wait, I'm just one more thing
Yeah.
about supplements. You do want to take a name brand, because some of these supplements. So you say there's stores of them or they're sold on the internet, and it could be out of someone's garage. So go for name brands, established brands.
Okay. So that's sound advice. Let's move on a little to bone health and muscle mass. And certainly as an exercise physiologist, I am keenly aware of how, healthy bones and adequate muscle mass are going to be a world of difference in, like you said, the quality of your life, the quality of your athletic performance, how you feel, your risk of injury, all of that. So I think with bone health, just sort of explaining to maybe our audience when should people, what can they do to prevent it, and when should they start having that evaluated?
So Heidi mentioned this already, but it's important to just know the trend of bone density over the lifespan, and that very early on, like 25 is when you hit your peak. So being able to get to that peak is really important. And that's where eating disorders as a teenager can be so detrimental if you don't start with a peak that's high, because that bone density will gradually go down, and then once you hit menopause, where the estrogen levels drop, that slope becomes steeper. So there's different ways where people can get into that bottom range of osteoporosis if they don't hit their peak bone mass, if their bone density declines at a steeper rate, if they go into menopause early, if they have to be on medications that affect hormone levels. So basically, it's like starting high and then trying to slow the decline is the goal.
Okay. And so at what point would you want that, maybe explain what a DEXA is, and at what point you actually should find out about your bone health?
So a DEXA is a special type of X-ray that looks at your bone density, and the U.S. Preventative Task Force that puts out these very broad guidelines that clinicians should be following recommends that the average person start being screened at 65. But if you have certain risk factors earlier, that's very old to some people.
Not that 65 is old, just
right?
Just
Screening.
To get a DEXA.
Yes, it is. I think, and it's interesting because the trend recently in terms of cancer screenings, all the age cutoff have been coming lower and lower. Like breast cancer, just last week, they started recommended starting screening 10 years earlier. So I want a part of me is maybe we'll start screening earlier for this one day. But people who do need to get screened earlier are people who have certain risk factors, and you should talk to your primary care doctor about if you have those risk factors. But then once you get a DEXA, if normal, you generally repeat every 2 years or so.
Okay.
But then in terms of who needs medications to treat their low bone density, it's really if people are in the osteoporosis range, or or if you're in the osteopenia range, but you have certain features or risk factors that put you at a higher risk for fracture. So those are like where the recommendations are right now.
So the key really comes back to what you were saying about
and I
starting.
just want to add to
make
that
sure you
because-
have bone density when you're a kid. Yeah.
Right. So I want to talk a little more about it because we didn't really talk about the athlete triad or REDS, relative energy deficiency in sport. And you mentioned eating disorders, but the truth is it doesn't have to be eating disorders. There's so many people with disordered eating. We live in this diet culture who, whether intentionally, intentionally because they're trying to lose weight, unintentionally because their life is busy, they're underfueling. So especially for active women and active girls. So I see so many of this in my office, which is the athlete triad is when you are underfueling and you go, well, how could that be? I can go out and practice field hockey every day. Well, that's because that's where your energy is going to be able to cover the activity you're doing right now. But we have to feed our physiology. We have to feed our heart and our lungs and our growth and repair and our hormonal system, right? And our bone growth. Like all of these things have to happen. And if you don't take in enough calories, then you have low energy available for all of these internal things that are happening. And that's also REDS, relative energy deficiency in sport, right? So compared to what you're doing, you're not taking in enough. And it affects not just your bone health. Well, let me go back to the athlete triad. So when you have this low energy availability, your body begins to shift what's going on and slows down. So you might feel bloated. Oh, I don't want to eat, I'm so bloated. But you actually need more food because your gastric system has slowed down, or you're not building your reproductive hormones become askew and dysfunctional really and shut down. Stop getting your period. Young girls should be getting their period. It is not a badge of honor that they're working hard. It means they're not taking enough fuel and they don't get their period, they don't have their hormones, now they're not building their bone health. And so that triad of low energy, interrupting hormonal health, affecting bone development at a very crucial age, can affect you for the rest of your life. And it's not all you have to correct that as quickly as we can because it can take a long time to then restart your period. And the longer you go without your period, the more you're not building your bone because you need that estrogen for your bone plus calcium and all of that. And that can, of course, doesn't end in those high school years. I see many college age and then women who continue to have, a very complicated relationship with food and undereating. So undereating is a big deal because rarely does it, I talk about learning how to eat to manage your weight versus dieting to manage your weight because we are affecting not just our weight, we're affecting our hormones, our bone, our mental health, our brain needs to be fed. So there's all of these ramifications and it hurts our muscle. So you might be working hard, going to the gym, working hard, and not seeing the results you want, not being able to increase your strength or your power or even your cardiovascular endurance. And that can all be related to how you're fueling. In addition to, we talked in the beginning, what are some of the nutritional effects that you might see in your office? I often get referrals even from, again, because we work as an interdisciplinary team at women's sports. So PT might say, we've been working with this woman who we just don't see the muscle integrity or they're not responding as they should. We want to check out their nutrition. And sure enough, it's not until we correct their nutrition that they can begin to see the results of the hard work they're putting in. So it's all interrelated.
Mm-hmm. And for muscle mass as well, obviously, it's not just calcium; it's protein. It's the quality of the total diet.
It starts with total calories. Then we could look at again: are you getting enough carbs? Are you getting enough protein? Are you even fruits and vegetables contribute to, and even fat contributes to the quality of your muscle. We've learned so much more because of inflammation, and as we age, inflammaging, and fruits and vegetables help to temper that inflammation, and that inflammation hurts our muscles.
Let's talk a little bit about the role of nutrition in injury prevention and healing from injury, because obviously you see people who are healing, and I've had the experience of having, so let's say a client who maybe was coming back from an injury and thought they should cut down on what they eat because they're not doing as much exercise. And can you both just speak to kind of what's the role there in terms of coming back fast and performing better than you did before?
Sure. I think nutrition can be incredibly important when we're trying to recover from an injury. But I also think that like our general recommendations for hopefully you had a healthy diet in the first place, and you don't need to like make a change to your diet because you're injured. So I think the recommendations would still be the same, having like a healthy, well-balanced diet that has adequate amounts of calories and macro and micronutrients. But I think it's interesting because if you do have someone who, if they're sidelined with an injury, like a lower extremity injury, and they really, because sometimes I have injuries where I have to tell people, you have to weight bear on this as little as possible. You have to be like a couch potato. It's really tough because that person may have had an overuse injury where they were doing a lot more before, such as like a stress fracture. And I think you still need enough calories, you still need enough protein, but maybe that's a place where you could cut back on like the more empty calories that, but you still have to you shouldn't be trying to lose weight or go into a calorie deficit. It should be maintaining and like enough to maintain muscle.
And I also think it does depend on what the injury is and what part of the body is affected. Like if you're on crutches, you actually need more calories. While you're healing, like right after, you might need more calories. And just being realistic with, do you live alone? Are you in the city where you can order in? Do you have to have meals ready? Who's going to bring you your meals if you're not mobile? Like how are you going to get access to food? Like there are other things to consider. And then just things like vitamin C throughout the day. Vitamin C helps with wound healing. So are you getting in enough vitamin C? Is it bone involved? Really making sure you're getting in that calcium for that bone remodeling to happen. So there are... Look, basic good nutrition is basic good nutrition, and really, how much does it vary throughout the life cycle? It's but yes, it can be crucial. Poor nutrition, to your point of good enough, poor nutrition will hurt your healing. You don't have to eat perfectly to eat healthfully, and eating imperfectly is not going to impede your healing. But not getting in good nutrition will impede your healing. Right. But if you eat an ice cream while you're healing, you're still going to heal.
And you'll be happy.
You're going to be, and right, it's okay. It's comfort food sometimes really works.
So as we're winding up, is there sort of any one key takeaway you'd want to tell active women kind of across the lifespan that they might want to keep in mind when they're thinking about their regular eating habits?
For me, it's always ditch the diet culture, focus on function, on health, on performance, on satisfaction, and you will take much more pleasure from food. It's a much better place to move from for everything, really.
And your healthy weight will kind of be a result of that.
Yes.
You're
more stable.
You'll come
Get
to
off
a
the
healthy,
roller coaster.
Yeah.
Yeah.
How about
I
you?
would say I would take it back to the beginning again with just like thinking about if you look at what your lifestyle health looks like and specifically your nutrition, like where are some takeaways that you like maybe there's just one or two things that we talked about today where you can say, you know what, that's a realistic thing that I can improve, and it's something that is going to actually make an impact in the long term. So it doesn't have to be perfect, but hopefully there's a couple takeaways that can really move the needle for you.
Well, thank you both. It's been such a pleasure. We learned a ton, and so thank you, Heidi, and thank you, Dr. McKenna, and thanks to all of you for coming tonight. We're grateful for your attention tonight.